Sure, ma'am.
So it is in duct-dependent lesions like TGA they mentioned, and then side effects they mentioned fever, apnea, and hypotension.
Okay.
Dose is 0.1 mic to
0.1
1 gram per kg.
Okay. So I will show the answers. Many of you have given correct answers. Okay. So it is maintained patency of ductus arteriosus, as all of them have mentioned, duct-dependent lesions. And the dose is 0.05 to 0.1 microgram per kg per minute. Once the desired effect is reached, the patency has reached, you can try to reduce this also in order to decrease the adverse effects. So adverse effects, hypotension, apnea, tachycardia, flushing and fever. In first day, you can see that fever and flushing kind of thing also is there. So that is a thing. So anyway, in which disease we should not close, which cyanotic heart disease we should not close the duct, or it is contraindicated?
Here, someone mentioned TAPVC, obstructive TAPVC.
Yeah, in TAPVC.
And TGA with intact VST, they said.
With restrictive, restrictive AST, because it is not indicated to open the ductus, it's not useful. Second question, 30-year-old G4P3L3 at 35 weeks of gestation with pain abdomen for 2 hours, AFI between 2 to 3. This is the CTG. So identify the type of decelerations, and in what condition do you see this kind of decelerations? What are the other types of decelerations and associated conditions? You know.
Divya Krishna mentioned it as late deceleration, and Pani also mentioned it as late deceleration.
How, Divya, if it is late, why do you see this one in the middle? It is not related only with the contraction of the uterus.
Dr. Surendra Murthy mentioned it as variable deceleration.
Yeah, variable is right.
Divya Krishna mentioned it as variable.
So where do you see? Which condition do you see the variable decelerations?
Cord, somebody makes cord compression. Surendra Murthy said it's a cord compression, and Abdul Shabir said the cord compression.
Yes, that's a correct answer. I'm showing you the answers. So recurrent variable decelerations, and it is seen in cord compression. Okay, what are the other decelerations you see? Early decelerations when head is compressed in the pelvis. Late decelerations, there are various causes for late decelerations. One of it is uteroplacental insufficiency. Okay, so for this, categories of fetal heart rate abnormality. Abnormal category. Just tell me what are the category 3. Fetal heart rate tracing category 3. So recurrent variable deceleration comes under which category? What do you mean by recurrent variable deceleration? When do you call it recurrent? Any definition of this one, recurrent?
Sarita Sadhu mentioned it as reverse. Sanjay Rao mentioned it as Sanjay Or mentioned it as sine wave. Abdul Shabir mentioned it as 3. Sarita Sadhu mentioned absent acceleration.
Absent acceleration? Absent acceleration is not mentioned anywhere. What is 3? I don't know what you have trying to say. But anyway, any recurrent variable or late decelerations or bradycardia or sine wave pattern, all these things come under category 3 only. But when do you call it recurrent? What percentage of recording should it be there to call it recurrent?
Surendra Murthy mentioned it as 50%.
Yes. In a 20-minute recording, more than 50% or 50% persistently there is called as recurrent. Okay. Good, very good. So this is the third OSCE. What is the neonatal condition on the X-ray? What are the types? What are the different types seen? You can just mention how many types, need not mention what exactly. Which is the most common type of this condition? Normally seen What are the other associations with this condition?
TEF. Divya Krishna mentioned TEF. Vinay mentioned it is TEF.
Okay, right. Yeah, that's the right answer.
Vinay Vijayan
Right
said
answer.
5 types. This is type C, what he mentioned. Vinay,
Okay, that's
Vinay.
good. That's good. That's very good. What are the associations?
Everyone is mentioning type C. Bacterial association. Divya Krishna mentioned
Yeah,
bacterial.
very good. So all of you know the answer now, right? So take case of this is a very simple kind of ask this one. There are 5 types. Type C with upper and blind and lower and connecting is the most common type we see. Upper and blind. So a lot of choking, lot of fluid collection is there. So that kind of presentation is normal. Normally, it's all I think 80% and beyond. Okay, and the associations are bacterial and charged. These are all things you have to look for. If you see one thing, you have to look for all the other abnormalities. Do the scans and echoes and see everything.
Charge association. Somebody mentioned Vinay.
Yeah, good. So the fourth asking, diagnose a condition. What is the dose of folic? We have already talked about this. To mothers in case previous pregnancies are affected. Name to antenatal test and amniotic fluid for neural tube defects. What is portable test?
Everybody mentioned it is meningomyelocele.
Yeah, this is very obvious. The second one we have already answered. The third and fourth.
4 mg. Sarita Sadhu mentioned it as 4 mg. MMC mentioned it as 5 mg. We discussed it already. And Abdul Shabir mentioned it 400. Didn't mention any parameters.
Okay, microgram he meant.
Okay. Sujay R mentioned it alpha fetoprotein.
Okay, two test. AFP is the right answer. Next.
Hello.
Yes. Someone said hello.
Hello.
Is it Manisha?
Beta HCG and alpha fetoprotein mentioned by Sarita Sadhu.
Okay. Beta HCG. No. Okay, anyway, I'm going to the answer. Anyone mention about the quadruple test?
Papa and AFP, no. No one mentioned.
Okay. Okay, I'm going to the answer.
Sarita mentioned the quadruple AFP and yesterday.
Quadruple test, everyone should be knowing. It's a simple thing, right? This we keep discussing every day, isn't it? Right, this is the answer. Obviously, meningomyelocele, 4 mg, it's higher dose. 0.4 is required, but 4. But we have folic acid as, the tablet folate is available as 5 mg only. Individual tablet is like that. In combination, the lesser doses are also available. So it is alpha fetoprotein, acetylcholine esterase, maternal serum alpha fetoprotein, and acetylcholine esterase. Okay, so what is quad test? Beta HCG, serum alpha fetoprotein, unconjugated estriol, and inhibin. Okay, so the beta HCG value varies. It decreases in some trisomies, it increases in some trisomies. You have to read that up also. Okay, right. Next question. So all of us know about disinfection and sterilization, right? So just tell me the contact period needed for disinfecting an instrument or whatever equipment and sterilizing. Okay, then name the disinfecting agent you would like to use for mask, face mask. Sorry. Disinfecting agent to be used for laryngoscope blade, and how do you disinfect suction apparatus? You have to be very careful with the suction apparatus because that's very important for all your ventilated cases. So all of us should know how to disinfect it. Keep an eye on the staff who's cleaning.
Not even a single answer, ma'am, so far.
Yeah, no answers so far. Probably they are Googling it now.
So this is very important. You should have an eye on what is happening around you. Because suddenly when infection crops up, suddenly when BAP develops, we don't know where it is.
Nowadays, I think they need not Google also. They can go for Meta AI. Easiest way.
So should I give the answers, sir?
Yeah. Somebody mentioned face mask, UV gamma irradiation. Surinder Murthy.
Gamma irradiation.
You can go to the answers, ma'am.
I'm going to the answer. So the contact period is 20 minutes for disinfection and 4 hours for sterilization. There are books which say 30 minutes and 6 hours also, but 20 minutes and 4 hours are also enough in the majority of the guidelines. Okay. So face mask, how do you clean? I mean, how do you disinfect? Was this difference between disinfection and sterilization? You understood, right? So when we are talking of disinfection, I'm talking of 20 minutes of exposure to 2% glutaldehyde. Okay, so glutaldehyde is available as a liquid which has to be activated with a small. You are provided with another small amount of liquid with which it gets activated. So you activate that fluid which is provided from the company, and then you use a small amount of it in a liter of water, and then you immerse all those things. Okay, that is how you do it. So laryngoscope blades which we are using 70% isopropyl alcohol. So 70% alcohol is available in many of even your hand sanitizers and so many things also. Beyond 70%, you have burns on your hands. So 70% is the ideal concentration. Anything less than that is not useful. So suction apparatus. This is very important. The suction apparatus contains a fluid, right? A clear fluid that should be at least like 3% phenol or 5% Lysol. Check that if it's happening in your unit. And you are supposed to change the suction bottle every day. And when you change it, the change bottle has to be cleaned with the detergent first. Then for disinfection, you have to use again 2% glutaldehyde. And of course, the suction tube has to be changed every day. If you think it's too contaminated, you can change it whenever you feel it's contaminated. So this is how you do it. So please keep a watch on what's happening around you. Okay, so this completes the OSCE. Is Manisha available? I'm removing the screen. Is Manisha there?
Ma'am, I think she is having issues